This is the biceps brachii. It flexes and supinates the forearm. The origin is the scapula at 2 points, both anterior and posterior, and the insertion is the radius. This is the brachialis. It flexes the arm at the elbow joint. The origin is the humerus, and the insertion is the ulna. This is the brachioradialis. It flexes the arm at the elbow and is the synergist to the brachialis. The origin is the humerus, and the insertion is the radius. This is the triceps brachii. The function is extension of the elbow. The origin is the scapula and humerus, and the insertion is the ulnar olecranon. This is the pronator teres. It pronates hand and forearm. The origin is the humeral, medial, epicondyle, and ulnar coronoid process, and the insertion is the lateral side of the radius. This is the pronator quadratus. It pronates hand and forearm. The origin is the anterior distal end of the ulna, and the insertion is the distal end of the radius. This is the supinator. It supinates the forearm. The origin is the ulna and lateral epicondyle of the humerus, and the insertion is the radius. This is the anconeus. It extends the elbow. The origin is the humeral lateral epicondyle. The insertion is the olecranon process of the ulna. This is the flexor carpi radialis. The function is hand abduction and flexion. The origin is the medial epicondyle of the humerus, and the insertion is the metacarpals 2 to 3. This is the flexor carpi ulnaris. The function is hand adduction and flexion. The origin is the ulna olecranon and medial epicondyle of humerus. The insertion is hame pisiform and metacarpal 5. This is palmaris longus. The function is weak flexion of the hand at the wrist. The origin is the medial epicondyle of the humerus, and the insertion is the palmar aponeurosis. This is the flexor digitorum superficialis. It flexes fingers 2 to 5 and the wrist. The origin is the humeral medial epicondyle, ulnar coronoid process, and radius, and the insertion is the middle phalanges of fingers 2 to 5. This is the flexor digitorum profundus. It flexes fingers 2 to 5. The origin is the ulna and interosseous membrane, and the insertion is the distal phalanges of fingers 2 to 5. This is the flexor pollicis longus. It flexes the thumb. The origin is the radius and interosseous membrane, and the insertion is the distal phalanx of the thumb. This is the extensor digitorum. It extends finger. The origin is the humeral lateral epicondyle, and the insertion is phalanges 2 to 5. This is the extensor carpi radialis longus. It abducts and extends the wrist. The origin is the lateral side of the humerus, and the insertion is the second metacarpal. This is the extensor carpi radialis brevis. It extends and abducts the wrist. The origin is the humeral lateral epicondyle, and the insertion is the third metacarpal. This is the abductor pollicis longus. It abducts the thumb. The origin is the ulna, posterior radius, and interosseous membrane. The insertion is the first metacarpal and trapezium. This is the extensor pollicis longus. It extends the thumb. The origin is the posterior ulna and interosseous membrane, and the insertion is the distal phalanx of thumb. This is the extensor pollicis brevis. It extends and abducts the thumb. The origin is the posterior radius and interosseous membrane, and the insertion is the proximal phalanx of the thumb. This is the extensor indicis. It extends the index finger. The origin is the posterior ulna and interosseous membrane. The insertion is the middle distal phalanges of finger 2. This is the extensor digiti minimi. It extends the little finger. The origin is the humeral lateral epicondyle, and the insertion is the proximal phalanx 5. This is the extensor carpi ulnaris. It extends the hand and adducts wrist. The origin is the humeral lateral epicondyle and posterior ulna, and the insertion is the fifth metacarpal. This is the thenar eminence. It opposes, flexes, and abducts the thumb. The origin is the tubercle of the trapezium and the associated flexor retinaculum, and the tubercle of the scaphoid. The insertion is the lateral margin of the metacarpal of the thumb, lateral side of proximal phalanx of the thumb, and base of the proximal phalanx of the thumb. This is the hypothenar eminence. It controls the little finger. The origin is the hook of the hamate and the associated and adjacent flexor retinaculum, the pisiform, and the tendon of the flexor carpi ulnaris, and the insertion is the medial margin of metacarpal 5, base of the proximal phalanx of the little finger. These are the lumbricals of the mid-palmar. They flex metacarpophalangeal joints and extend the interphalangeal joints. The origin is the palm, the lateral sides of tendons and flexor digitorum profundus, and the insertion is fingers 2 to 5, the lateral edges of extensional expansions on first phalanges. These are the dorsal interossei and the palmar interossei of the mid-palmar. They abduct and adduct the fingers. The origin is the sides of the metacarpals, and the insertion is the extensor expansion on the first phalanx of each finger, except finger 3, on the sides facing finger 3.